Hi everyone and welcome to my channel. Last year I did a year's dental core training in maxillofacial surgery. Now to get this job I had to do the national recruitment process, as did everybody else. My ranking was number 1 out of 520, which was a significant improvement from the year before where I ranked much further down. When the results came out, I looked further into how I changed my technique. I made some deliberate actions to try and improve my score, and I also had a look at the system and the way the markings were done to try and improve the overall outcome. Almost daily, when it's coming up to the interviews, I get messages from people on Instagram, on Facebook, asking me for tips and tricks on how I got this ranking and how I secured my first choice job in the country. I'm more than happy to answer these questions, but I felt that I was saying the same thing over and over again, and it would be a bit easier to make this into a video which anyone can access, and therefore everyone's getting the same advice consistently from me. Now, I've got a small disclaimer, obviously I'm not involved with the interview process, I don't know what the questions are, and I'm not an interviewer on any of the panels. All I can really do is give you my personal experience, advice and things which I changed personally to improve my score, and ways you can think about structuring your answers to help you feel more confident on the day and make sure you don't miss anything. So I've got all the information on a laptop in front of me that I want to talk about with you. So if I keep looking down, that's what I'm looking at. The national recruitment process varies slightly from year to year where they keep changing things. However, in general, it's formed of various stations, so communication skills, clinical governance, and a clinical scenario, plus the situational judgment test, which is a series of different questions and answers that you do in a multiple choice exam. Tip number 1 is going through various guidelines in advance. So personally, I really like the NICE guidelines. It means that you're up to date with current knowledge of what's going on in dentistry and things which we should be doing for our patients. For example, the wisdom teeth removal guidelines, I think these are really useful, and it also helps being able to quote these to patients. Having a clear understanding of these means that in your interview, if any scenario comes up which they apply to, you can show awareness of these clinical guidelines when asked about them. Secondly is the SDCEP guidelines. I think these are really well structured and really clear to read. They also give you more information about ways different clinical situations could be managed, and if you understand these guidelines, again, they can be brought up in interview scenarios. By showing your interviewers that you really understand these guidelines shows that you know not only where to find the information, but how to act on it for your patients and when it's appropriate to use these guidelines in your clinical practice. Next, the 7 pillars of clinical governance. So these can be found online. There are varying forms of those, but I think it's really important to have been through them and understand what all of them are, what they mean to you. Personally, I wrote a list of the 7 pillars of clinical governance, and then based on this, I wrote an example of each and how that affects me in my general practice. So then I was able to answer any questions on any of the 7 pillars of clinical governance. Now, I personally was asked about personal development and CPD, and I'd already planned this out in my 7 pillars of clinical governance plan. So I was able to just draw on that, and I'd already thought about it. I think one of the main things with national recruitment is being prepared. So whatever topic is brought up, you've already kind of covered that and you feel more comfortable talking about it. In terms of books that I used, I get asked about this quite a lot. Firstly, the Olivia Pickard Medical Interviews textbook I found brilliant, and some of the things I'm going to talk about are things which came from that book. Now, I definitely wouldn't do the book justice if I tried to explain everything in it. I really recommend buying that book, and it's one you can use year after year for any interviews that you have. Specifically for national recruitment, I found the structuring answers sections most helpful, and the positive words and phrases, which I'll elaborate on a bit as well. The Oxford Assess and Progress SJT book. There are a few different ones available now, so there's more dentistry focused ones, but these weren't available at the time when I did national recruitment, so I definitely recommend maybe borrowing those from the library or even purchasing them. You only get one shot at national recruitment each year, so doing your absolute best that you can is worth the investment. My next tip is being prepared, structuring your approach and having a plan. So the Olivia Pickard book again goes into lots of different ways of structuring answers and having a different structure for each type of question. One structure which is elaborated on in the book that I think is fantastic is the SPIES structure, and this is a way of managing difficult situations or scenarios. For example, the one which we often hear is your consultant turns up drunk to the ward, what do you do? Now, the SPIES stands for 5 different points. First is seeking information. So you want more details about the situation. What's actually happened? Is this fact? What's been going on? Next, patient safety. So that's the P in SPIES. Is the patient safe? Are the other patients in the area safe? And how can I ensure this? So what could I do about this? The I stands for using your initiative. So is there anything you can personally do to improve the situation? Escalate. So does the situation need escalating? So for example, the consultant turning up drunk on the ward, who does that need escalating to, and what are you going to do about it? And finally, the second S is support. Does anyone in this situation need support? Now, this is something which I personally think can be overlooked quite easily in exams and interview scenarios because you're so focused on the patient's best interest, focusing on the patient. If the colleagues turned up to work drunk, it's likely they also need some support. So showing that you've considered this, I think, gives you a little edge in your interview, and it shows you've really thought through the bigger picture, which is important in both medicine and in dentistry. So regarding the 7 pillars of clinical governance, the 7 which I based my preparations on was clinical audit, number 2, clinical effectiveness, 3, staffing and staff management, 4, education and teaching, 5, risk management, 6, patient and public involvement, and 7, information and IT. So for each of these topics, I wrote down its relevance to dentistry, how it impacted me in my day-to-day practice, and also I included an anecdote or a key story to do with when this impacted me. So not just day-to-day, I would try and think of a specific incident where this was relevant. And next, I would recommend practicing. I think this is so important and again can be overlooked. Because national recruitment means being ranked against each other effectively, the whole process can become really competitive. In my opinion, practicing will give not only you but the people you practice with confidence, but you can also learn from each other. So it's not just one-sided, you'll all benefit from this process. So I really recommend practicing. Potentially helping the one person you practice with is definitely worth the sacrifice to feel more confident on the day and for it not to be the first time you've heard yourself say these things out loud. So I recommend leaving as much time as possible to prepare. The more you've been over these things, the more confident you're going to feel and the more relaxed compared to if you're trying to read through loads of guidelines the night before the interview. Personally, I did a little bit each night for a long period of time rather than trying to cram it all in, especially when you're trying to juggle this with finals, other interviews that you may have, and exams and essays. It can be quite stressful. I'd recommend dressing to impress. Now, this might sound obvious, but you want to look professional. The people interviewing you are likely people who will be working with dental core trainees or dental foundation trainees. So therefore, if you look the part and they feel as though you're someone that they can relate to or could see themselves working with, you're going to score more highly than if you turn up in your onesie. My next piece of advice is be yourself. Now, this can be really difficult, especially at the point when you're all waiting to go into the interview. You're looking around, seeing everyone else, all the competition. But if you're not being yourself, you're not being genuine, it's going to be quite obvious to the interviewers, in my opinion. So I think the more authentic you can be, the more genuine you can be, the better. Now, personally, in one of my interview stations, I admitted I didn't know the management for that scenario. I was asked, how would you manage a fractured mandible when it comes into A&E? Now, I hadn't done a head and neck surgery job before, and I didn't know the ins and outs of management. However, I did know how I could find this information. So I was completely honest. And said that I didn't know exactly what the management was of that situation. However, I would go ahead to speak to someone senior to me that was appropriate, for example, my second on call, to seek more information. I would ask colleagues in the same department if I was working with anyone, if they knew the answer. But I stressed to the interviewers that if I didn't know the appropriate management, I'd make sure the patient was safe. I'd done everything within my competency to stabilise them. For example, if there was a bleed, putting pressure on this, and I would seek appropriate advice. I lost no marks on this station, even though I didn't know how you would manage a fractured mandible at the time. But what I did do was demonstrate how I could manage this appropriately and effectively and the patient remaining safe. I didn't just make it up just for the sake of giving an answer. My next piece of advice is using positive words and phrases. So this is something again in the medical interviews book, and it was something I'd never really thought of before. Here's an example. Saying someone asked me to, or I have been lucky to, suggests that things that have happened to you have come through chance or through the action of somebody else, rather than you actually earning these things and seeking out the opportunities. A more positive way of rephrasing these things would be, I have developed a strong interest in, or I've played a key role in managing the following. So just looking at how you phrase things to make it sound as though you're in control and you haven't been given these things on a plate or by chance, I think makes a really big difference with how you come across. The situational judgment test. I think practice really does help with this, but I have 3 key pieces of advice to help you get through. Number 1 is practice. Like I've just said, I think this is key to success, but also trying lots of different books, working out the different techniques that are suggested, experiencing these is really helpful. Don't just rely on one book and one resource, because the types of questions can vary, like I said. Now, secondly, it's important to know how much time you have. So looking at the number of questions, the amount of time you have, and working out the number of minutes per question. This is really important so you don't run out of time. It's much better to put something than nothing. And then finally, the way to actually answer these questions. For part A, we'll ask you to rank 5 answers in order of most appropriate to least appropriate. There's 2 approaches to this. One which I did the first time round, another which I did the second time round, which was completely different. They sound very similar, so listen carefully. The first approach is ranking the answers in the order that you would do them. So, for example, I'm going to use a couple of silly answers and 2 realistic answers. So, a patient on the ward is unwell in a way which you can't manage by yourself. What do you do? Number 1, get your registrar on call, who is completely competent to manage this scenario. Number 2, call your consultant who is on call, who is also completely competent to manage this scenario. And we'll say answers 3, 4 and 5 are do a dance, go on a lunch break, have a glass of wine. If you were ordering these in the order you would do them, you might get your registrar, accept that the situation has been dealt with, do a dance, grab your lunch, get some wine, and then get the consultant. Because if it's been dealt with, the consultant's irrelevant now. This is not the way which you should approach the questions based on the year when I sat the SJT exam and the advice which I've also been given. Instead, you would give your first answer, which would be get the registrar to help, because if they're competent to deal with the situation, they're less qualified than the consultant, so they would be your first choice. Next, when you've answered that question with get the registrar, you remove that answer from the question completely and reassess your 4 remaining answers as though the question was only out of 4 to begin with. So now, if you just have 4 answers, the patient's unwell, what do you do? Get a consultant, do a dance, have your lunch, or have a glass of wine. You'd get the consultant. So this has changed our answer from being registrar, dance, lunch, wine, consultant to registrar, consultant, which has moved the answer of consultant from number 5 to number 2, which is a massive difference, completely different order. So this is what you need to keep in mind. Give your first best answer and then forget it exists. And then imagine you only had the remaining 4 to begin with and reassess the question fresh out of the 4 answers, which is the 1 best action. And this really helped me when I was doing the SJT to understand a completely different way of approaching them and to do them correctly. Next, I recommend showing off without being a show-off. So it's important to show your best attributes, your skills and your knowledge without coming across like a show-off. And again, this comes with practice. My next bit of advice is to reflect. So acknowledge when you don't know the answer, when things haven't gone to plan, and be happy to show that you are willing to develop and improve these areas and that you can recognise when things haven't gone to plan. Particularly discussing audit and reflections is really important, as this is a massive part of foundation and core training. Finally, it's never too late to improve your CV. If you feel like you're short for time, start now. Don't keep putting it off. Don't think that it's too late. Keep working hard. And finally, good luck.